So if you're tired, achy, dealing with brain fog, struggling with weight loss, or just don't feel your best, chronic inflammation could be a part of the picture. But how do you know if you actually have inflammation? So let's talk about it. First, inflammation isn't always a bad thing, right? So if you have acute inflammation, it could be part of a healing process. So you got a cut, you had an infection, you got an injury. Inflammation helps your body recover from that. The problem is chronic inflammation. This is when your immune system stays activated for months, years. Some of the biggest drivers of chronic inflammation are ultra-processed foods, excess sugar, could be refined carbohydrates, those frequent blood sugar spikes that we talk about that are not good. It could be poor sleep, could be strong chronic stress, it could be from smoking, could be excess body fat, especially around your waist, physical inactivity, certain underlying health conditions as well. So what can you actually test? Some direct markers of inflammation include hs-CRP, CRP, ESR, also called sedimentation rate, ferritin in some situations, fibrinogen, white blood cell count. Then there are the markers that aren't inflammation tests like those, but are often associated with inflammation and can help us understand what might be driving the inflammation. And those include, of course, fasting insulin, fasting glucose, your hemoglobin A1C, your triglycerides, HDL, cholesterol, also waist circumference. So now let's talk about what you can do about it. One of the most powerful tools is food. Some of the foods most associated with inflammation include sugary drinks, candy, desserts, white bread, highly processed grains, fast foods, fried foods, your ultra-processed foods, like I said, snack foods, foods that combine a large amount of refined carbohydrates and industrial fats, like seed oils. So instead, you're going to want to focus on high-quality protein, non-starchy vegetables, healthy fats, seafood, eggs, meat, poultry, whole foods as close to nature as possible. Many people also notice improvement when they eat in a way that allows them to spend time in nutritional ketosis, like we talk about. Ketones that you produce when you're in ketosis aren't just a fuel source, they also act as signaling molecules in the body and can support a healthy inflammatory response. This is one reason some people choose a very low carbohydrate, protein-focused, healthy fat-forward approach to support metabolic health. And don't forget the basics, of course, our non-negotiables that we talk about all the time. You're gonna walk for 10 minutes after a meal, you're gonna prioritize sleep, you're gonna try to manage your stress, you're gonna build your muscle through resistance training, get sunlight, especially that first sunlight in the morning on naked eyes, get outdoors, don't smoke. The good news is that chronic inflammation is often influenced by the choices that we make every day. Your body was designed to heal when given the right environment. Have you ever had your hs-CRP checked? Let me know in the comments. And if you're interested in metabolic health, dealing with insulin resistance, ketosis, understanding your labs, please follow along. I'm here to help answer your questions and support your journey to better health. And remember, taking care of your health is one way we honor the body that we've been given. If you have any questions, please feel free to drop them below. You can head over to my website, lyndsycarlson.com, and reach out to me on the contact form there. I also have some offerings if you need extra support, medication reviews, lab reviews. I can take on a small number of metabolic health clients as well. I hope to hear from you, and I hope you have a blessed day.